Last but not least, in material methods, this is where you put your ethical and your humanitarian issues, whether you're dealing with humans or animals. Very important. And you have to state very specifically, if it were a controlled randomized trial, for instance, that you had a data and safety monitoring board. Or for any study that has to deal with humans, or at least explain why you did not do it, your institutional review board approval. It's very elementary, it's very scholastic, it's very like elementary school words, but it has to be stated. We have to know this. Very important also, specific connections with industry and conflicts of interest. Obviously, all journals ask you to write a statement that you have or have not conflict of interest. I even go to say that if there is one, it has to figure someplace. Perhaps not always in material and methods, but maybe in a discussion. Here we see an example where it's specifically mentioned that the study was conducted in accordance with the Health Insurance Portability and Accountability Act. Informed consent. This is also a very important ethical issue. Consecutive patients. Prospectively enrolled. All these words are very important. Increasingly important also are definitions. Even if you think everybody should know what you mean by a specific word, don't hesitate to give your definition, which may be a little bit different from what other people think. Here we have a definition of the endpoint of the secondary analysis, how the rates were calculated, how they were censored. I'm going to stop just for a few minutes. Are there any questions about introduction, title, summary, introduction, material methods? I continue. Results. What do you talk about in the results? Not results, nothing else. Your results. The results from that study that correspond to the methods that you've just put in your chapter on methods. No one's else. No other results of another study that you did. Include the results that relate to the question that you asked or the hypothesis that you raised in the end of your introduction. If there are other results that are part of your study, you can put them in an annex, you can put them someplace, but don't put them in the chapter results. Don't confuse the reader. You've asked a question, you've raised a hypothesis, you've done your methodology. Give the results of that methodology. What corresponds to your hypothesis or your question? And as for material methods, no interpretations, no comments, especially emotional comments like only 2 complications, no discussion, just raw facts. Okay? An example of what you should not do, I think. Yeah. Here's results, but this is methods. He forgot to put it in methods, maybe, I don't know. But this does not belong in results, it belongs in methods. It's very common that people make that mistake. If possible, do not forget those negative numbers. Remember, I talked to you about the positive numbers and the negative numbers in material methods. You have to give the results of the positive numbers and the negative numbers in the results. If possible, it's very important. If you cannot do it, you have to say something about it in the discussion. It takes away from what we call the external validity of your study, the applicability of your study, of the results. Everybody know the word internal validity and external validity? Internal validity relates to the methodology of your study. External validity relates to how you can apply those outcomes to an overall population, how you can generalize. We'll talk about that when we talk about statistics. Here's an example. 8 women were excluded because whatever reason. And the outcomes, simple sentence. This is important. It reduces the possible bias of the outcome. For results, this chapter should be as short as possible, and you can make use of figures, graphs, tables as much as possible. This is probably the best way to relate that information. But there has to be a balance between what you put in the text and what you put in the tables or the figures, and no repetition. You may choose one method. The editor may say, okay, well, this is better in text, this is better in a table. Professor Boni is going to talk to you in a few minutes about what you should put into your tables and methods, and tables and figures and graphs. The editor might ask you to change from one to the other. Not a problem. A question that comes up very often is, where do you put the number of subjects, the number of participants? If your study is retrospective, I would say that it belongs in methods. If your study is prospective, it can be in methods. It should probably be results. For a controlled randomized trial, certainly it should be in results, because it's part of your methodology. You've randomized, you've done a randomization. It's part of your results. Once again, in both methods and results, remember what I told you in the style? 100% of your patients have to be accounted for. No room for guessing what happens to the others. Missing data are always suspicious. Unconsciously, you think, why didn't he tell us about those 4 patients? There's nothing wrong with saying that you didn't do something or the data is not available. State it. Be honest. Go on to the discussion. Any questions about material methods or results? Very straightforward. Along with the abstract and the introduction, perhaps. Sorry. The chapter discussion is what requires a little bit of skill. The discussion has a specific goal, and that is to discuss what you found, your results, compared to what has already been done or what has already been published. What you, as a writer, thinks they should mean to the reader, and you have to be able to objectively put that forward, and what they imply. It's not a review of the literature. It's not a review of everything else that has been done on the topic. It begins with the answer to the question that you asked at the end of your introduction, or the confirmation of the hypothesis that you raised. That's the first sentence, or at least the first paragraph of your discussion. Here we see an example, a little bit of an introduction, but we find the major result. Shorter course was associated with significantly. What's wrong? What's missing? The word statistically significantly, fewer days. Last sentence in the introduction was this. First sentence was this. After that, you're going to explain how your results support that answer. How that data supports the outcome of your hypothesis. And most importantly, how that fits into existing knowledge on that topic. You're going to compare your results to what others have done and found. This is the essential part of your discussion. And don't forget the order, the chronological order in material methods is the same that you use in results and the same that you use in your discussion to make sure that the reader understands what you're talking about in what order. So, you're going to compare your results with the literature. You have looked for and you have found something. You've looked for methods, you found results. Are they the same that somebody else has, or similar to what somebody else has found? What he has looked for and found. And you can say, our results are similar, and you explain why you think they are similar. Or they're different. You explain why you think it's different. Our study was in the Veterans Hospital, only men. The other study was men and women, just as an example. Our study was in 1935. Let's say 2017, and the other study was in 1935. There has to be a reason why there might be a difference. Either similar or different, and explain why. Emphasize the strengths and the weaknesses of that study. As I've just said, the dates might not be the same. The gender of the population might not be the same. But also, what was found in your study but the others did not look at? Obviously, they didn't find. Or, and why? Or what others found but they did not look for. You didn't do it. They did it, but you didn't do it. This is what the discussion is essentially about. It's going to give the value of what you found to the conclusion, and whether you can say, this is what we found, and this might be something that's extrapolable, it's exportable, it's something that can be used for a different population. For each item, in chronological order, as I said, material methods, results, and discussion. If the outcome was unexpected, try to explain why. If there's another way of interpretation, try to explain why. Give the strengths and the weaknesses of yours as well as theirs as concerns the material methods, the results, or the discussion. It's even possible and recommendable to have a specific chapter after you've done that comparison in your discussion, saying, what are the strong points of your study? It's a randomized controlled trial. It was a large population-based study. As well, the weaknesses. It was not a randomized controlled trial. Or we didn't use a specific multivariate analysis. Whatever the reasons you feel are important to the outcome. Retrospective study is another limitation. Whatever you do, do not be overcritical when you make that criticism of other papers. Do not cite only what goes in your direction of thought especially if there are other papers that have come to opposite conclusions compared to yours. Do not be attempted to write a comprehensive review. This is not what a discussion is about. Very difficult and important. Do not repeat information that's in the introduction. Only concentrate on what your results are as compared to what you said in the introduction, the question that you were going to ask. Once again, provide the shortcomings, the flaws, the insufficiency of what you have done and what you have found. Very important, I'm going to try to make you laugh a little bit. Avoid what we call elitism and triumphalism. Elitism, we are the tertiary center, the first in the world to have discovered whatever. Or triumphalism, yeah, this is the first controlled randomized trial. You're very proud, understandably, of your hospital, of your institution, of your tertiary referral center. But this doesn't belong in the discussion. Whatever your argument is, it has no meaning. People are going to know that it's a tertiary referral center. You don't have to relate it. Tertiary referral high volume center. I'll show you an example later on. It's just to put a hammer on a nail. Very difficult in a discussion is to repeat the methods or results. You can do it, but only as you relate the comparison. An example. Difficult. But interpret the outcome or potential by data which have not been success, especially yours. Don't do that. Sorry. Negative results are important. I talked about negative numbers. The discussion has to relate to those negative numbers and negative results also. If not, you're denying uncertainty. You end the discussion, or you have a specific chapter called conclusion. Now, please, conclude only on your population. You saw the example that I showed you before. Our results suggest that whatever. In your conclusion, you can tell the reader how you feel that your results fit into that clinical picture. Remember I talked to you about the external validity. Are your results applicable to other populations? Where do we go from here? Is this useful information? Can we use it for our daily practice? If so, how do we implement it? How do we make sure that people use it? And how, in the future, we can improve the shortcomings, if there are any. This belongs in your conclusion. And your implications have to be given specifically. You might also want to say, where can we go from here? What are the future goals? What are the future research topics? What are the spin-offs of your methodology? What are the offspring of your results or other goals that might be interesting in the future? Obviously, everybody uses the same typical topic, saying further randomized controlled trials are needed. Okay, that's ridiculous. Just do it. Do the randomized controlled trial. Or say that yours is not a randomized control trial in the discussion, and you will wait for them, but not as a conclusion. Avoid conclusions that are inconsistent with the data. Avoid conclusions that are not pertinent, inadapted. You found that A is better than B, and then you talk about C in your conclusion. That's not what the conclusion is about. The conclusion is relative to your study. Avoid conclusions that are misleading. You found that A is better than B in a cohort study. You cannot come to a conclusion. Professor Boney told you that. You cannot conclude that A is related to B. It's not a randomized controlled trial. Don't say it in your conclusion. And don't put information that cannot be interpreted or can be ambiguous, misleading. This is really usually what comes from underpowered studies, sometimes from well-known ethos, or even spin. Spin is a term that relates to spinning your head someplace. Politicians are very good at spin. They want to sell you a school or give you a school so that you'll vote for them. This is not what medical writing is about. You don't want to sell anything. Okay, I'm going to stop here. Any other questions about IMRAD?
It's more a comment. I think the discussion part is the most important part of the paper you should write with your co-author altogether, because you need to really have, result, methods, is straightforward. Result comes from your study. The methods comes from the design of your study. The discussion part, you need to have more head, and you will end up doing this discussion several ways differently according to the point of your co-author. I think that is still important. And the second part is actually really, you really need to be aware of all the literature that is present on the topic of your paper, because one of the reasons of the comment, if a reviewer is doing his job properly, he will check the current literature and he will find out you didn't quote, you didn't compare your study with this one. This will be really bad. You will put your paper in a very, very bad view from the reviewer point of view. So this guy, he forgot, 3 or 4 larger studies. So this is one of the most frequent common comment from the reviewers. Say, well, what about this study? What about this study? What about this study? So this is what probably having, that's a co-authorship probably is the most important part of the co-authorship, is really the discussion of the paper. That's my comment.
Very important point, Luigi, and it leads me to another comment of, once again, how you compose, how you write, in what order do you write. I personally do my tables first. I have my results. I write my methods afterwards. That's fairly straightforward. Then I write my introduction to make sure that I have a goal that corresponds to what my methods and my results are. And then only then do I write my discussion. And I do it, as you said, with somebody else. If you write your discussion by yourself, you can read it and reread it and sleep on it for hours and days and months. It's going to be biased. It's only yours. You're going to lose that objectivity. And for that objectivity, you have to have coworkers. For one, and you have to sleep on it and go do something else and come back to it later. You get intoxicated when you write a paper. You think you know everything, and you've written everything, but you don't realize, because you're intoxicated, you're drowned in what you're talking about, what you're thinking about. You have to have an expert, somebody else, outside opinion, to look at it objectively. Yes?
This is Sanjeev from India. My question is it a good idea to begin the discussion with a summary of the results, or is it a repetition?
Not exactly the results, but the answer to the question that you're asking. It's not exactly the same thing. It's your main result, yes, but it's one sentence, yes?
So could you put all those summary of the results again in the discussion to begin with, and then try to elaborate on each of these?
If I understand correctly, you're worried about if there's a lot of results.
Just the summary of the positive or the negative result to begin the discussion.
Okay. Yeah, no, that'll be in the discussion. You have one main endpoint, theoretically, and one main question. If you have secondary questions and secondary results that you can look about, you do that in the discussion, not in the first sentence. Only the main.
Okay.
Other questions or? Yeah, sure.
This is Muhammad. I have this question about talking about the missing data. So in the you showed us a part in the results that you were talking about missing, and also you mentioned the cause of that missing persons or data. So
Missing
is
data.
that a
Missing
good,
data, yeah.
so
Lost to follow up?
shouldn't we talk about the missing data in the method and material?
You have to say, yes, somewhere in the results, that you have a certain amount of patients that were lost to follow-up or were not analyzed. And in the discussion, you have to talk about it because it's one of the weaknesses of your study. Methods, no, not in the methods, but in the results and in the discussion.
So we should mention the cause of that missing in the results.
If you know the cause, that's great.
Okay, thank you.
That should be, you have to be very honest.